Hi, everyone. It's Cheryl Bujold. I am your health insurance broker, and I am sending you this video because it is annual enrollment time for Medicare. And what that specifically means for you is it's time where you can take a look at your Part D, your prescription drug plan. So I wanted to take a few minutes to send this video and get onto the Medicare website and show you step by step how you can do a search for a drug plan and see if there is maybe something for the new year that is better coverage, better cost than what you've got right now. So hopefully you have all received a letter from your current company letting you know what your premium will be for the new year. And so we want to go through this process to do a comparison and see if maybe there's something that makes more sense for you. It's really important to know if you do enroll in a new plan, that will be effective January 1st. So anything you do from October 15th through December 7th, new plan takes effect January 1st. What's really important to know as well is your current plan will terminate automatically when you enroll in a new plan. So you don't need to contact your current company and do anything to end that plan. So CMS takes care of everything for you behind the scenes. They get you enrolled in the new plan and they get your current plan canceled for you. So I'm going to take you over to the Medicare site right now and kind of take you step by step and show you what you will be looking at and what you will be doing. So you go to medicare.gov, and the first thing I want to point out is that you will want to either log in if you already have an existing account, or go ahead and take the time right now to create your account. This will save you time later on because once you're logged into the system, your medications should automatically appear for you. So, so that'll save you a step later on from having to manually enter them. You don't have to. You can certainly enter them yourself, and that will be what I'm taking you through now to show you how to do that. But I think it's worth the time to go ahead and create the account or log in if you already have one. But what I'm doing, I don't have an account to log into, so I am going to take you through the process of what it looks like without logging in. So I'm clicking on Find a 2022 Health and Drug Plan. I am clicking on Continue without logging in. And then on this screen, what are we looking for? We're looking for a drug plan, Part D. None of these other options are applicable. You will enter your home zip code and click Continue. Then the next question is, do you get help from any of these programs? So I'm going to assume that you don't. These would be financial assistance type programs. So I'm clicking this last bubble, I don't get help, and click Next. So I have already have a medication that has been entered in here. So this is what would happen if you logged in. When you come to this screen, your medications should already appear. And take a look at it, make sure everything is correct, your quantity, your dosage. If anything needs to be changed, you will click this Edit Drug button, and let's just see what that looks like. So let's say I am now taking 10 milligrams of lisinopril. You will change the dosage and click Update this drug. So if you need to add another drug, we're clicking the Add Drug. The system is pretty intuitive, so you really only need to start typing. You will see different drugs pop up. And if you find your drug, as soon as you find it, you will click on it. So let's do Janumet, and we will add the drug. You will again find your correct dosage. Click on it. Make sure your quantity and your frequency is correct. If it's something that you're taking once a day, but you're filling that prescription every 3 months, so perhaps your quantity would be changed to 90, and then in the frequency, you could just change to every 3 months. But we'll leave this the way it is. And once all of your medications have been added, you will click Done Adding Drugs. This is where you will select your pharmacies, and it will automatically default to a distance of 1 mile. I usually like to change that up to 5 miles. You'll click 5 miles, you'll hit apply. All the pharmacies in a 5-mile radius will appear. The pharmacies I already have selected are the 5 that I most recommend searching. Your Walmart, CVS, Fry's, Safeway, and Walgreens. And when all the pharmacies that you want to look at are there, you'll hit done. And your results will appear. So based on the 2 medications that I put in, this is showing the AARP Medicare RX Walgreens plan as the lowest cost. Now, this does not necessarily mean that you need to fill your prescriptions at Walgreens. So we will take a look and see what the different costs at the different pharmacies will be. But a high level view of this plan shows you that the premium is $27.60 a month. With the drugs that I entered, we're looking at a yearly out-of-pocket cost to you for your premium and your drug costs of $1,476. So I ended up choosing a pretty expensive drug in this example. So let's click this blue plan details. And again, a high level, they're showing you your premium and what your total drug costs will be. But let's go ahead and scroll down and take a look at some more details of this plan. So right off the bat, they're showing us the pharmacies, and Walgreens, as you would expect, is going to be preferred. Walmart is out of network, so you definitely do not want to go to Walmart if you choose this plan. Let's keep going down. And then you will see, oh my gosh, if you did go to Walmart, your out-of-pocket costs for the year just shot up to $7,000. But look at all the other pharmacies. They are all, relatively in the same neighborhood, but because Walgreens is the preferred, that will have the lowest cost. Let's keep going down. And this is going to tell us that you're going to meet your deductible in January. Again, that Janumet is a pretty expensive medication. So with your out-of-pocket costs for that, you're meeting your deductible in January. You will enter the coverage gap in September. And you're not paying enough to where you will leave the coverage gap. And let's talk about that for a second. So the coverage gap is also known as the donut hole. And for 2022, that is $4,430. And if you were going to come out the other end of the coverage gap or the donut hole, you enter what they call catastrophic coverage, and that is $7,050 for the new year. Let's keep scrolling down and see what we would be paying each and every month. So again, keeping in mind, Walgreens is that preferred pharmacy. So in January, your out-of-pocket cost is $350, which is why you are reaching your deductible right off the bat in January. For all the rest of the months, February through August, you are paying $40. Now you're hitting that donut hole or the coverage gap beginning in September. And so your cost share kind of changes a little bit. So you can see what your out-of-pocket costs would be for the rest of the year. So this is a really good way to know what you're paying each and every month. It's a great way to budget, so you know ahead of time what you're going into for the year. So now you're going to compare this, to what your current plan will be. And then another thing that this example is not showing you is once you log into your account, the plan you currently have will appear. It will show you what your current plan is, just in case you're not sure. So if it's making sense to make the change, you would click this green enroll button, or let's go back to the search results. Let's just take a look at what the next plan down would be. So the next plan down, this is interesting. Your monthly premium is much lower. It's only $13, but you can see your yearly cost for your premium and your drugs is $1,494. Again, we'll go back up. It's not that much more money compared to the $1,476 of the recommended plan. But to me, the premium is not so much the driving factor in your decision, but what your overall cost for the year will be. So let's go ahead and decide to enroll in this AARP plan. You click the enroll button. You will click join plan. And then this is where you will start to enter your information. So your Medicare ID number, which can be found on your red, white, and blue Medicare ID card, will be the first thing you enter. You'll come down, you'll click the agreement, and then you will hit next. And then that's, again, where you will start to enter all of your personal information. Once you finish the process of enrolling, CMS will, again, behind the scenes, take care of getting you enrolled in that plan and get you terminated from your current coverage. And that's all there is to it. You'll just look for that bill to come in the mail. If you want to set yourself up on auto pay when that bill arrives, that is entirely up to you. I always recommend auto pay, so it's something that you don't have to worry about, forgetting to pay. And so I just wanted to let you know that I am here for you. If you have questions or you need assistance when you're going through this process, I will have my contact information appear at the end of this video. Also, I'm going to send a link in the email that is accompanying this video that will just give you a little bit more in-depth description or definition, if you will, of what the 4 phases of the coverage are. Your initial coverage period, that donut hole, your catastrophic coverage. So just in case you want to do a little reading up on refreshing yourself on exactly what all of those terms mean and how it may affect you. Also important to know, if you do not take any medications and you are on the lowest cost plan right now, that plan is changing. So I'm also going to provide with this video an attachment that will give you some step-by-step instructions on how to just get yourself enrolled in the new lowest cost plan for the year, which is only going to be $7.50. So I'm looking forward to hearing from you. If you do have questions or need assistance, please don't hesitate to reach out. Thank you so much, and stay well.